So coronary angioplasty, sometimes also called PCI, is a procedure that we do here to open blocked arteries in your heart. Sometimes that includes a ballooning of the arteries, or we also may place a stent inside those arteries to keep them open. Those are all performed sometimes as a emergency procedure. When a patient has a heart attack, they come in to us and we try to open up those vessels to provide blood flow to the heart. Or it can be a scheduled case. If a patient has some sort of like chest pain, shortness of breath, all those can be also reasons to come in for a heart cath. You may need coronary angioplasty, like we touched on earlier, in case you're having a heart attack. But also, there are a number of different tests that your physician or your can do when people are having chest pain, shortness of breath, any of those classic symptoms where it's harder to breathe. They may do a less invasive test at the office. A stress test, Lexi-scan, different kind of things. And when you fail that test, then we'll bring you in for a heart cath, or not necessarily angioplasty, but for a heart cath as the gold standard to verify if you have a blockage anywhere. So your physician and your nurses will talk to you before the case. Normally they'll have you be NPO, which is nothing by mouth, usually for 8 to 10 hours. Up to maybe 12 hours before the case. So usually the night before. You'll want to double check with them for your medications. There are certain medications that they'll want you to withhold. There's other medications that they'll want you to continue normally, especially if you're diabetic. So that's something you want to check with them first. Then the day of your heart cath, usually you'll come in, you'll check in our holding area. Our nurses will check your vital signs, get you all situated, and any other medications that you might need, including some sedation before your procedure. During the procedure, you'll be brought into the room. We'll have a team of nurses and technologists, that will assist the physician during the procedure. We'll put you on one of our tables. The nurses will hook you up to your vital signs. So we'll check your heart rate. We'll check your blood pressure. We'll usually have an IV for medications. And then we'll also do some shaving. So these procedures usually are done either through the wrist or through the groin. So we will either shave your wrist or shave your groin. We have two axes, so your arterial axis, one through the groin is your femoral artery, or through your arm. What we'll do is we'll go up with catheters up through the artery and into your heart. And what we do is we shoot contrast dye to check the vessels. So that contrast dye we're seeing through X-ray. We'll visualize the vessels in your heart, make sure that there's no blockages, and go from there. If we see a blockage, then that heart cath can turn into balloon angioplasty, or we can do different things to open up that blockage.
So after your procedure, after your angiogram, you're gonna have all your catheters removed. You'll be left with a sheath either in your groin or your wrist. You will either have a stitch placed or some type of closure device in your groin, or if you did go in your wrist for access, you'll have we call the TR band. It looks like a bracelet that holds some pressure on that where we went in through your artery in your wrist. So if we went through your groin, you're gonna have a few instructions. You're gonna have to lay completely flat for a few hours. You may be tender there. A little bit of soreness is completely normal. Things you want to watch out in your groin are any type of bleeding, swelling, anything like that. The same goes for your wrist. We'll put that device on your wrist. It looks like a little bracelet with a balloon on it. It's gonna hold pressure there. You wanna watch for any type of bleeding. It may be a little tender. It's very important if we go through your wrist not to use your wrist for a few hours until we start letting out some of that air, and we just go down about 15 minutes, every 15 minutes after a 2-hour mark. So when that takes place, your nurse will come and do that as well. So right after the procedure, we'll put one of those devices in to help hold pressure. You'll either come out to the holding bay or you'll go up to your room, depending on if it was an on-call thing or if it was during hours. From there, your nurse that sees you right after the procedure will go over some more post-op instructions as far as laying flat, if you can have anything to drink, things like that. So you may get to go home the same day, or you may have to stay in the hospital overnight, maybe a few days, depending on the severity of the procedure that we performed and just kind of watching you. It all depends on how you're recovering and what your cardiologist thinks is best. You have any type of chest pain, or you start having any other issues with those sites that I talked about, your groin or your wrist, any type of bleeding, oozing, swelling, numbness, anything extremely painful other than it just kind of being tender, you'd want to give your doctor a call. So after the procedure, once you go home, you're back to normal activities. You definitely want to, if you are a smoker, you want to definitely try and stop smoking. You want to follow up with cardiac rehab. It's extremely important to follow up with them. Take all the medications that your doctor has put you on to get you on the right track. If we did put some kind of stent, it's extremely important to take your blood thinning medication every day. If you stop that, it could put yourself at risk at having another heart attack. It's extremely important. If anyone asks you to stop it or quit taking it, you want to call your cardiologist before anything. You do not want to stop taking that.